When it comes to headaches, everyone seems to have an opinion, and it can be hard to know what is fact and what is fiction. Many people actually have little understanding of what a migraine is or how to control it. Headache doctors in the fields of neurology and psychology developed this video to provide a better understanding of why this painful condition occurs and what you can do to calm the migraine storm. The information presented in this video is not based on one person's opinion or experience. Instead, this video is based on information learned from hundreds of studies on migraines. Migraine headaches can have a huge impact on someone's life. In fact, they account for more difficulties in doing normal physical, school, work, and play activities than any other neurological condition. Yet migraines do not show up on medical tests. Although a lot of people fear that their headaches mean that something dangerous is happening in their brain, 95% of headaches are safe. Most headaches are caused by a simple change in the electrical balance of the brain. In fact, a migraine is like an electrical storm in the brain. The storm causes temporary changes in the brain that lead to head pain and other symptoms, such as being extra bothered by light and noise. So even though migraines can be agonizing, most headaches are not dangerous, despite the severe pain. Chapter 2. How can doctors tell if my headache is safe? While there are many types of headaches, migraines are the most common type of headache that leads someone to seek the help of a nurse or doctor. This is because migraines often are painful, frequent, and difficult to control without help. Migraines occur in about 10 to 15% of children and adults. About half of the people who experience migraines, however, don't even know they have them. Doctors usually can diagnose headaches just by asking questions and performing a physical exam. Brain tissue is different from most other parts of the body because it does not contain pain receptors. This is why damage to the brain is actually unlikely to cause pain. For example, despite extensive damage to brain tissue, strokes do not usually hurt. And while brain tumors can cause head pain, this does not occur until the tumor is large enough to cause other problems that will be obvious to a doctor, such as seizures or abnormalities on a neurological examination. Therefore, a doctor can usually tell if your headaches are safe just by asking about your headaches and by performing a physical exam. Since medical tests can't actually show pain, many years ago headache doctors developed internationally agreed upon criteria to make the most accurate diagnosis of headaches. The criteria have been studied many times since they were first developed and are still reliable to this day. These criteria include features of the headache, such as how severe it is, where it is, what it feels like, and what other symptoms are present when the headache occurs, such as sensitivity to lights and sounds, or nausea and vomiting. Sometimes tests, such as blood work or MRIs, may be ordered to help feel certain that no other medical condition is causing the headaches. Usually, these tests will be normal. While normal tests can be reassuring, many still wonder how headaches can hurt so much, yet not show up in the tests. Chapter 3. Why do I have migraines? About 70% of individuals with migraines have a close family member who also has migraines. This suggests that the tendency to develop migraines at some point in life may be something that individuals inherit and are born with. In particular, people with migraines were likely born with a brain that is really sensitive or reactive to the environment. This is likely why some people get migraines and others do not. Even though migraines are partly genetic, they can start at any age, such as 5, 15, or even 50 years old. All of our brains must keep a balance in the way that the nerve cells in our brain communicate with each other. If the electrical impulses that nerve cells use to communicate with each other become too strong or too weak, then a migraine can begin. Even when a headache is not occurring, the migraine brain does not properly control the balance of nerve cell impulses. As a result, the migraine brain stays really sensitive. This means that things like lights, noise, smells, weather changes, and menstrual cycles can start a painful headache in the sensitive migraine brain, but leave a normal brain unaffected. Also, even normal amounts of stress you experience from school, family, conflicts, daily hassles, and so on, can upset the balance of nerve cell impulses in the migraine brain. This is the reason why headache treatment aims to keep the migraine brain calm and healthy each day. For example, eating healthy starting with breakfast, drinking plenty of water, and keeping a consistent sleep schedule are all part of keeping the brain in balance. In addition, individuals with migraines should learn and use effective relaxation techniques each day to keep the brain calm. If headaches are occurring over 4 days per month, a doctor may also recommend taking daily medications to control the headaches. People are often afraid that daily medications are just covering up the symptoms. However, the prevention medications actually work by keeping balance in the nerve cells to reduce how often migraine storms occur and how severe they are. Unfortunately, there is not a cure for migraines, but with proper treatment, headaches typically improve and most people can have a better quality of life. Chapter 4. What is happening in my brain to make it hurt? A migraine headache occurs when the electrical impulses in the brain become uncontrolled and no longer function properly. There are many phases of a migraine, just as there are many phases to a storm. Different symptoms may occur in each phase. It's important to understand the phases of a migraine in order to understand how to feel better. Just as with a storm, there is a build-up stage in migraines during which people can tell if they have a migraine coming before the pain actually begins. This stage is called a prodrome. During the prodrome, people may notice food cravings, mood changes, fatigue, difficulty thinking, or even yawning. These subtle symptoms are likely caused by temporary changes in the electrical impulses deep within the brain. During this stage, it may be possible to prevent the headache with rest, relaxation, drinking water, and distraction. Like a storm that gradually builds up and rain begins to fall, the migraine process continues to build as the nerve cells become more unstable. At this point, some people may develop an aura. Auras happen in about 1 out of every 6 people with migraines. These auras are usually visual and can be scary and hard to describe. Rarely, the auras can also include other changes, such as numbness, weakness, or speech problems. These temporary auras are not damaging to the brain. Similar to storms having a stage where rain falls hard and lightning and thunder begin, the next stage of a migraine is the headache phase. This is probably the phase most people are familiar with. During this phase of a migraine, all the nerve cell disruption that has taken place sets off a chain of events that leads to activation of pain receptors on the outside of the brain. The pain receptors are set off by incorrect electrical impulses, not actual damage. It's important to try to stop the headache as soon as this pain begins. Otherwise, the migraine will continue to spread and start several different symptoms if not stopped early. Sometimes resting, drinking water, eating, or sleeping can stop a migraine. Other times, over-the-counter medications, such as ibuprofen or acetaminophen, can help. If these options do not work, a doctor may prescribe migraine-specific medications called triptans. Be sure to limit the use of any medicines you take to stop your headache to less than 10 days a month. Taking these medicines any more than 10 times per month may increase your risk of developing more frequent migraines. Most people with migraines know what will happen if the migraine headache is not stopped soon enough. Some may develop intense nausea and vomiting. Others may want to avoid lights, noises, and smells. The pain can become throbbing and worse with normal movements. Sometimes it can hurt just to touch your head, brush your hair, or even lay your head on a pillow. Sinus pressure, neck pain, dizziness, and blurred vision can occur as well. At this point of the headache phase, the migraine storm is in full action and can feel like it will never end. The migraine pain can last for hours to a few days. Rarely, when it lasts longer, it is called status migrainosus. Often, people become afraid and frustrated when the pain takes over. They may cry or yell. These reactions can actually make the migraine stronger rather than helping to calm the brain back down. This is why stopping a migraine requires more than just medication. The best way to stop a migraine is to also learn relaxation techniques that work directly to calm the disturbed electrical impulses. Finally, similar to storms that have a phase in which the storm begins to wind down, migraines have a post-drome phase. Sometimes this is also referred to as a migraine hangover. People may experience fatigue, nausea, and difficulty thinking during this phase. Once the post-drome is over, the brain returns to its normal resting state, unchanged and undamaged.